Hello, everyone. Today I'll be discussing one of the more important operational issues facing healthcare organizations today, supply chain disruptions. In this presentation, I will explain why supply chain disruptions occur, how they affect healthcare organizations and society, and what evidence-based management strategies leaders can use to improve operations. Supply chain management is much more than purchasing supplies or stocking shelves. According to Langabeer and Hilton, supply chain management includes procurement, storage, transportation, logistics, and collaboration among manufacturers, distributors, healthcare organizations, and patients. Every day, thousands of products move through this system before reaching the bedside. The goal is to deliver the right product in the right quantity, at the right location, at the right time, and at the appropriate cost. When supply chains function effectively, clinicians can focus on caring for patients rather than searching for supplies. Efficient supply chain management also helps healthcare organizations reduce unnecessary costs, improve operational performance, and maintain high standards of patient safety. Because virtually every department depends on medical supplies, supply chain management plays a central role in successful healthcare operations. Although healthcare organizations strive to maintain a reliable supply of medications, equipment, and medical supplies, disruptions still occur for many reasons. According to Langabeer and Helton, healthcare supply chains involve numerous organizations and processes, including manufacturers, distributors, transportation providers, and hospitals. Because so many parties are involved, even a small disruption in one part of the supply chain can quickly affect the rest of the system. Recent research also highlights that healthcare supply chains directly influence patient safety and quality of care. Smith et al. Explained that improving supply chain performance is essential because reliable procurement systems support better clinical outcomes and reduce risks associated with shortages and delays. For example, delays in receiving medications or surgical supplies can postpone procedures, increase patient wait times, and force healthcare providers to spend valuable time searching for alternative products. Inventory shortages may also require hospitals to purchase supplies at higher prices or pay additional shipping costs. This places greater financial pressure on the organization. Communication problems between vendors and healthcare organizations can further complicate forecasting and inventory management, increasing the likelihood of stock shortages or unnecessary overstocking. From an operations management perspective, supply chain disruptions are more than an inconvenience. They represent a systems issue that affects efficiency, quality, patient safety, and financial performance. Quality leaders must understand these interconnected processes to develop solutions that improve organizational performance while ensuring patients continue to receive safe and timely care. Supply chain disruptions affect much more than inventory levels. They influence nearly every aspect of healthcare delivery. At the organizational level, shortages on medications, equipment, and medical supplies increase operating costs, reduce efficiency, and often delay patient procedures. Healthcare organizations may be forced to purchase products from alternative vendors at higher prices or pay additional shipping costs to obtain urgently needed supplies. These unexpected expenses place added pressure on already limited healthcare budgets. Healthcare providers are already directly affected. Nurses, physicians, pharmacists, and other clinical staff may spend valuable time searching for supplies, modifying treatment plans, or communicating with multiple departments when products are unavailable. These workflow interruptions reduce productivity, increase workplace stress, and can contribute to employee frustration and burnout. Instead of focusing entirely on patient care, providers must devote additional time to solving operational issues. Patients experience the most significant of the consequences. Delaying in receiving medications, diagnostic tests, or medical procedures can extend wait times and negatively affect the patient experience. In some situations, supply shortages may even create patient safety concerns if clinicians must substitute unfamiliar products or delay necessary treatments. The Agency for Healthcare Research and Quality emphasizes that patient safety depends on not only clinical expertise, but also on reliable healthcare systems that consistently provide the resources needed to deliver safe care. Because healthcare organizations are responsible for serving their communities, operational disruptions can also affect public confidence and access to quality healthcare services. One of the most effective ways healthcare organizations can reduce supply chain disruptions is by strengthening collaboration throughout the supply chain. According to Langabeer and Houghton, supply chain management depends on cooperation among manufacturers, distributors, healthcare organizations, and clinical departments. Rather than viewing vendors simply as companies that sell products, Healthcare leaders should build long-term partnerships based on communication, trust, and shared goals. Healthcare organizations can improve collaboration by sharing information about inventory levels, anticipated patient demand, and product usage patterns. This allows vendors to forecast future needs better and respond more quickly to changes in demand. Establishing service level agreements, or SLAs, also helps define expectations for delivery times, product availability, and performance standards. Monitoring vendor performance through regular reviews encourages accountability and continuous improvement. Recent research further supports collaboration as a key component of healthcare supply chain resilience. Tiwari et al. Found that organizations with greater supply chain visibility and stronger information sharing are better able to respond to disruptions and maintain operational performance. By improving communication among suppliers, distributors, and healthcare organizations, managers can strengthen resilience while supporting more reliable patient care. Ultimately, collaboration shifts supply chain management from reacting to problems after they occur to proactively preventing disruptions before they affect patients. Many healthcare organizations address operational challenges through projects, making effective project management an essential leadership skill. Langabeer and Helton define a project as a temporary, organized effort designed to achieve a specific outcome, such as improving patient safety, reducing costs, or increasing operational efficiency. In healthcare, projects may include implementing new technology, redesigning workflows, optimizing staffing, or improving supply chain processes. Successful projects begin with clearly defined goals and measurable outcomes. Healthcare leaders must identify the problem they are trying to solve, determine the expected benefits, and develop a realistic plan before implementation begins. Executive sponsorship is equally important because leaders help secure the financial resources, remove organizational barriers, and demonstrate commitment to the project. At the same time, gaining buy-in from physicians, nurses, and other stakeholders encourages cooperation and reduces resistance throughout the implementation process. Langabeer and Helton explained that project success depends on balancing four key variables: deliverables, resources, scope, and timelines. Managers must carefully monitor project progress, track milestones, and identify risks before they become significant problems. Tools such as project dashboards and Gantt charts allow leaders to compare actual progress with planned outcomes and make adjustments when necessary. By following a structured project management process, healthcare organizations are more likely to complete improvement initiatives on time, remain within budget, and achieve meaningful operation improvements. Rather than reacting to challenges as they arise, project management provides a systemic framework for creating lasting organizational change. Even the most carefully planned project can fail if employees are not prepared to embrace change. According to Langabeer and Helton, people often resist change because it creates uncertainty and disrupts established routines. As a result, healthcare managers must focus not only on implementing new processes, but also on helping employees understand why those changes are necessary. The authors explained that successful change management depends on four essential elements: effective leadership, a clear operational plan, alignment of incentives, and adequate resources. Leadership provides direction and motivates employees, while a well-developed plan outlines how the organization will achieve its goals. Aligning incentives helps ensure that everyone is working toward the same objectives and providing sufficient resources. This includes staffing, technology, equipment, and training, which enables employees to adapt successfully to new processes. Communication is one of the most important responsibilities of healthcare leaders during periods of change. Blankabeer and Helton emphasize that organizations are generally more successful when they communicate early, communicate frequently, and focus on overall purpose of the change rather than the overwhelming employees with unnecessary details about it. Open communication helps reduce uncertainty, builds trust, and encourages employees to ask questions and provide feedback. Healthcare managers should also actively involve employees in the change process. Seeking input from physicians, nurses, and support staff increases employment engagement and creates a greater sense of ownership over the project. When people feel their opinions are valued, they're more likely to support organizational improvements and contribute to successful implementation. Ultimately, effective change management is about building trust. By communicating a clear vision, encouraging collaboration, and supporting employees through the transition, healthcare leaders can reduce resistance and improve the likelihood that operational improvements will be sustained over time. Healthcare organizations often hesitate to implement major operational changes because they involve significant financial investments, organizational disruption, and uncertainty. Langevere and Helton describe rapid prototyping as an evidence-based strategy that allows organizations to test ideas on a small scale before implementing them across the entire organization. Rather than introducing a new process hospital-wide, managers first conduct a pilot project with a single department or with a limited group of users. This approach allows healthcare leaders to evaluate whether the proposed solution actually improves outcomes before committing additional time and resources. During the pilot, managers collect employee feedback, monitor performance, identify unexpected challenges, and make adjustments based on the real-world experience. If improvements are needed, they can be made before expanding the project throughout the organization. Rapid prototyping also encourages a culture of learning and innovation. Langevere and Helton explained that organizations should recognize that not every pilot project will succeed. However, even unsuccessful projects provide valuable information that helps improve future decisions and reduces the likelihood of larger implementation failures. A culture that supports flexibility, collaboration, and continuous learning is essential for making rapid prototyping successful. Although Langevere and Helton specifically describe rapid prototyping as a means of testing improvements before full implementation, current research also supports the value of flexibility and continuous evaluation. Tiwari et al. Found that organizations with stronger visibility into their supply chains and greater use of digital technologies are more resilient when responding to unexpected disruptions. Testing improvements on a smaller scale allows healthcare organizations to refine processes before broad implementation while reducing operational risk. Healthcare organizations that apply evidence-based management strategies are better positioned to respond to operational challenges while maintaining high-quality patient care. Throughout this presentation, we've discussed four key strategies: strengthening collaboration, applying structured project management, leading organizational change effectively, and using rapid prototyping to test improvements before large-scale implementation. Together, these approaches create a more coordinated and a resilient healthcare system. One of the most important outcomes is improved patient safety. When supplies are available, workflows are efficient, and communication is strong, providers can spend more time delivering care and less time solving operational issues. The Agency for Healthcare Research and Quality emphasizes that safe healthcare depends on reliable systems that consistently support clinical decision-making and patient care. Healthcare organizations also benefit financially. Better inventory management, stronger vendor partnerships, and well-managed improvement projects reduce unnecessary expenses, minimize waste, and improve resource utilization. Langevere and Helton explained that effective operations management focuses on improving organizational performance while balancing quality, efficiency, and cost. Employees benefit as well. When operational processes function smoothly, providers experience fewer workplace interruptions and less frustration. Improved communication, clear expectations, and greater collaboration contribute to a healthier work environment and allow staff to focus on what matters most, providing excellent patient care. Smith et al. Also note that stronger healthcare supply chains contribute to higher quality clinical outcomes by improving the availability of critical medical supplies and supporting safer patient care. Ultimately, evidence-based management is not simply about solving today's problems. It's about building healthcare organizations that can continuously learn, adapt, and improve. By making informed decisions based on evidence rather than assumptions, healthcare leaders create organizations that are more efficient, more resilient, and better prepared to meet the changing needs of the patients and communities they serve. In conclusion, effective healthcare administration extends far beyond managing budgets or overseeing daily operations. It requires healthcare leaders to anticipate challenges, make evidence-based decisions, and continuously improve the systems that support patient care. As we have discussed today, supply chain disruptions can have significant consequences for healthcare organizations, providers, patients, and the communities they serve. However, these challenges can be addressed through thoughtful planning and strong leadership. Evidence-based strategies like collaboration through vendors, structured project management, effective change management, and rapid prototyping provide healthcare managers with practical tools to improve operational performance while maintaining high standards of quality and patient safety. Rather than being reactive to problems, these approaches encourage organizations to identify risks early, test improvements carefully, and create sustainable solutions. The most important lesson from today's presentation is that healthcare is an interconnected system. Decisions made in one department often influence many others. This makes communication, collaboration, and shared accountability essential for organizational success. When healthcare leaders work together, use evidence to guide decisions, and remain committed to continuous improvement, they create organizations that are more resilient, more efficient, and better equipped to provide exceptional patient-centered care.